Hello and welcome to Newsmax Health on Newsmax TV. Right now we're talking with Dr. David Samadi, Chief of Robotics in Minimally Invasive Surgery at the Mount Sinai Medical Center in New York. Dr. Samadi is a leading prostate surgeon and a pioneer in the field of robotic prostatectomy. It's great to have you with us.
Good morning.
Okay, Dr. Samadi, our viewers might not be aware that prostate cancer is the second leading cancer killer among men in the United States. 1 in 6 men will be stricken with the disease at some point in their lifetime. Robotic surgery is increasingly being used instead of traditional open surgery to remove cancerous prostates. Can you tell us how robotic surgery for the prostate works and the advantages it has over traditional open surgery?
Yes, robotic surgery is a minimal invasive treatment option for prostate cancer. And what it really means is that the surgeon sits about 10 feet away from the patient, and we use this fancy machine called robot. The robot doesn't do the surgery by itself. It's surgeon dependent. And whenever you choose robotic surgery, you should look for the most experienced surgeon, because it's the doctor that performs the operation, not the robot by itself. As I sit 10 feet away and I move my hands, all of those surgeons' movements are being translated to the tip of the instruments, so you can perform a very precise, very accurate nerve sparing, which is involving the sexual function and continence of a patient after prostate surgery. So some of the advantages are the fact that, when we were doing open surgery, there was a lot of blood around the prostate and we couldn't really see the detail of the operation, and we used to use our hands, or what we call tactile feedback, or the touch factor. By touching, we were deciding whether we should spare the nerve or not, or try to figure out where the cancer is. Well, guess what? Now, in 2012, since there is gas in the abdomen and there's no bleeding, and I can see very well, I don't need to put my hands there anymore, and there's no reason to really touch the prostate. That's not the way to go about it if you're an experienced robotic surgeon. We're able to do a much more precise operation using robotic Da Vinci surgery. Again, everything that I say in this interview has to do with the experience of the surgeon, not the actual robot. Less bleeding, faster recovery, 24 hours in the hospital, no transfusion, and being able to get back to work are some of the advantages of robotic surgery.
Now, if a man decides on prostate surgery to remove cancer, in your experience, is open prostatectomy ever the better choice over robotic surgery?
Well, this question comes up all the time because there's a lot of confusion among patients whether they should go for robotic surgery versus open surgery, and it really comes down to the experience of the surgeon. And I always tell them that if you have an excellent open surgeon versus somebody who has done only a few hundred robotic cases and they're not experienced, they should go for open surgery, because ultimately the outcome, which is the cancer cure rate, continence, and sexual function, is exactly what we're looking for. Now, if you have an excellent open surgeon and someone who is really well trained in robotic surgery, and we have to define that, somebody who is expert in cancer, somebody that has laparoscopic skills, somebody that has done thousands of cases and is personally responsible for your operation, if you have that, it doesn't make any sense to really cut someone open and go through open surgery with all that blood loss and transfusion and longer recovery. So robotic surgery in the hands of experienced surgeons are the way to go.
Dr. David Samadi, Chief of Robotics in Minimally Invasive Surgery at the Mount Sinai Medical Center in New York. It's been great talking with you.
Thank you so much. Thank you.